Hi, I'm Dalton Ritter from Federal University of Santa Catarina, Brazil. This video is about a clinical case published at Journal of World Federation of Orthodontics. The authors of this manuscript are me, Dr. Roberto Rocha, Dr. Arno Ox, and Dr. Gerson Ribeiro. This report details the diagnostics, treatment alternatives, planning and accomplishment of orthodontic and surgical treatment of an adolescent with skeletal angle class 3 with cleft, lip and palate. The cleft was surgically minimized by advancement of the posterior maxillary segment during combined orthodontic correction. At the initial facial examination, she presented moderate mandibular deviation to the right side, adequate mandibular proportions, convex profile and slightly reduced exposure of maxillary incisor when smiled. Intraoral clinical examination showed full anterior and posterior coarse bite, deep overbite and angle class 3 malocclusion at both sides. The panoramic radiograph showed normal root anatomy and also showed a velar cleft in the right side between the central incisor in supernumerary precanine. Cephalometric analysis evidenced the class 3 horizontal maxillomandibular discrepancy and vertical mandibular growth. The maxillary incisors were excessively retruded and mandibular incisors were protruded. The primary treatment objectives were to correct the anterior and posterior crossbite to achieve proper overjet, overbite and posterior intercuspation, to achieve a straight balanced profile, and to close or minimize the cleft to achieve arch continuity. The first mechanics used comprised a fixed expander anchored in the maxillary first molars to achieve a normal transverse relation. At the same time, the patient was instructed to use a facial protraction mask at least 14 hours a day. The protraction mask exerted a bilateral 300 grams of force on the maxillary first molars. After 6 months of treatment, the patient and parents recognized that the facial mask was not used enough, and the patient refused to use it. At this point, orthodontic surgery was planned and the option to close the cleft during this procedure was accepted, with the advantage of eliminating the procedure of secondary alveolar bone graft. The fixed orthodontic treatment with brackets prior to orthodontic surgery was conducted with the objectives of leveling the arches, positioning the incisors to allow total maxillary advancement and mandibular setback with slight rotation, and allowing additional advancement of the posterior right segment to close totally the alveolar cleft. The surgery promoted total maxillary advancement of 2 mm and mandibular setback of 3 mm. The mandible rotated 2 mm to the left side in frontal view. To close the right maxillary arch cleft, the posterior segment suffered an additional advancement of 3 mm, establishing contact between canine and central incisor.
Hi, my name is Roberto Rocha. In this case, I would like to make point about 3 aspects: the anterior-posterior discrepancy, the leveling, and the cleft space. About the anterior-posterior discrepancy, it was very high, and even with the face mask therapy, the orthodontic surgery was necessary, and in my opinion was the good option. About the leveling, it was very critical because we had used light wires and long time in form to achieve a good leveling, but to preserve the level on the alveolar bone and a good gingival margin. And about the cleft space, maybe another option could be the cleft, secondary alveolar bone graft. But in this case, the option was close the cleft space during the maxillary advance. The final and post-rotation records show that the result is very stable, and today she is a young mother, and she is very happy with your quality life.
O resultado para mim foi, nossa, muito gratificante. Poder me olhar no espelho e aceitar aquela imagem que antes para mim não era inaceitável, mas era uma coisa que mexia com o meu ego. Então depois de todo o tratamento, eu me olhar no espelho, me aceitar a minha imagem, os meus dentes mais bonitos, a minha face mais, como é que posso dizer, centralizada, não sei, alguma coisa nesse sentido, para mim foi muito gratificante.
See more details of our manuscript at the Journal of World Federation website. Thank you very much.